What is the difference between thought blocking and other thought disorders? Have you ever been in a conversation and suddenly lost your train of thought? For some, this experience can be much more intense and frequent. Today, we will discuss the difference between thought blocking and other thought disorders, especially in the context of schizophrenia. Thought blocking is a specific symptom often seen in individuals with schizophrenia. It involves a sudden and involuntary interruption in the flow of thought or speech. Imagine talking about a topic and then abruptly stopping mid-sentence. In that moment, the person may feel as if their mind has gone completely blank. This pause can last from just a few seconds to a minute or even longer. When they resume speaking, they might switch to an unrelated topic or struggle to remember what they were discussing. This experience is different from normal forgetfulness or distraction. Thought blocking is sudden and complete, often accompanied by a feeling that thoughts have been lost or removed. It can be quite distressing for those who experience it, impacting their ability to communicate effectively. On the other hand, other thought disorders encompass a wider range of disturbances in thought processes. For example, Alogia is characterized by a significant reduction in the amount of speech. People with Alogia may provide very brief responses and often do not elaborate unless prompted. This reflects a decrease in the quantity of thought rather than sudden interruptions. Another example is circumstantiality, where a person gives excessive detail in their speech. They may eventually return to the main point, but only after a long detour through irrelevant information. This can make conversations feel drawn out and confusing. Disorganized thinking is another thought disorder that can show up as incoherent or illogical speech. Individuals may use loose associations or even create new words. Unlike thought blocking, these disruptions in thought flow are more continuous and do not involve abrupt stops. Thought blocking is often seen as a negative symptom of schizophrenia. It reflects a loss in normal thought processes. In contrast, other thought disorders can be viewed as positive symptoms, which add or distort thought content. These may include experiences like delusions or hallucinations. Recognizing thought blocking is important for diagnosing schizophrenia and distinguishing it from other mental health conditions. Treatment usually focuses on managing the underlying schizophrenia with antipsychotic medications and supportive therapies to improve cognitive and communication skills. In summary, thought blocking is a sudden interruption in thought or speech, while other thought disorders involve broader disruptions in thought organization and content. Understanding these differences can help in providing better support for those affected by schizophrenia.